Hello everyone, welcome to anewbeat.org. I'm here today with the co-founder of anewbeat.org, Dr. Nisha Jhalani, and I'm also here with the CEO of Take the Lead, Gloria Felt. The three of us want to share with you why we believe anewbeat.org is one of the most important initiatives, definitely for me, that I've done in my career. It's 2019, and we're still talking about gender parity in wages. We're also talking about the care of women across all diseases, but we'll focus on cardiovascular disease, which is the #1 cause of death for women. And I want to repeat that. Cardiovascular disease remains the #1 cause of death for women. We find that there's a need for more female physicians caring for these patients, not because we believe women will just trust female physicians more, but actually there is good scientific data that no matter if it's men or women, female physicians deliver better quality and better outcomes. And so how do we engage more women to not only join our field, but also to support them in this great adventure of healthcare, one that for many of us, we feel it's the best career in the world. So I'm going to start off and talk a little bit with Gloria Felt about why it's important to focus on how we're paying women equally across all fields, but particularly in healthcare. And Gloria, why is it important to focus on gender parity in wages?
Well, if women don't have equal pay, they don't have equal power. And if they don't have equal power, they will never have equal position in any organization. And what we know from all the research is that every organization does better with diversity around the table, diversity of all kinds. And since healthcare depends so much on the quality of relationship, it matters who's seeing. It matters what patients see. It matters whose lens is seeing what that patient might need. And from a business perspective, we know that companies that have more women in their upper leadership make more money. So it's a win-win-win all the way around.
Totally agree. By the way, I like that win-win-win all around.
Yeah.
And Nisha, when you think of the work that we're doing today in caring for women with cardiovascular disease, and we understand that women leave and feel as if their needs haven't all been met or heard, what do we all do in anewbeat.org to help promote that for women, but also for us as the professionals who care for them? And by the way, right, it's not just physicians. It's nurses, it's the technicians, it's the administrators in the offices. Healthcare happens to be one of the fields that actually has a number of women, but we don't have a lot of women in the leadership areas. And so that's what we're trying to do. But how do you work in addressing that day to day, and how do you see us doing more going forward?
Absolutely. I think that part of it is just making sure that patients, women, feel like they're being heard. Right? And I think so much of it is a systems problem. I think that we focus on 20-minute visits, 15-minute visits, and making sure that we're within our time slot and cutting people off. And I think so much of healthcare is driven by what our day allows and the number of hours in the day. And I think focusing on women's needs, listening to their complaints, listening to their issues, their concerns, what scares them the most when they go to sleep at night, is part of the solution. I think that we really need to be focusing on the problem that women are presenting to the office with. And I think what's been shown is that female physicians can do that with a increased skill. I think that there's a skill set that goes into patient care that women have. And I think a lot of what is missing in not only healthcare, but across the board, is that women are too often passive. We're just passengers along, and we're thankful to have a role and thankful to have a job, and we just sort of say yes, let's just continue. And I think the purpose of anewbeat.org is to empower the leaders, empower the cardiologists, and empower the healthcare system to be able to challenge what's wrong, and say that we need to change things.
Yeah, I think some tips, for myself personally that I've used is, it's just as important for me to show up to work every day and provide great care or great service or whatever my job is. And then how much of that day I'm taking to focus on how am I furthering my own career?
Right.
How am I furthering my own wellness? And I think if we look at an 8-hour day, if we're saying we can't carve out an hour a day to do that, that really says that we need to step back. And I think really, I want people to know for newbeat.org, those are the types of tips we also want to give. How do you make it happen? How are you contributing to that? So do you spend any time, making sure you have lunch with colleagues? It's a great book that says Never Eat Lunch Alone. A book that I actually give out to a lot of people, because it really says, yeah, this is all meaningful. It matters. It matters how you network.
Right.
And so it's not just to talk about clinical cases, which is valuable, but if you're doing it with others, you're forming relationships and you're learning in an ongoing manner. It allows us to be able to have that team that
Right.
we need for almost everything that we do.
Absolutely, and I think one of the best things that came out of our program yesterday for a New Beat was that we had so many men present and so many supportive men present who were sharing the same ideas and the same message, saying that it starts at the mentorship level.
Right.
And I can remember as early in my training as undergraduate years, there were conversations that were happening with men that were not happening with me. What do you ask for when you sign a contract, and what should you be expecting? Don't just say thank you for having a job. Ask for the things that everybody else is asking for. And I think that until you have those contacts and until you make those connections, you're at a disservice. So this is really to connect women to other women who have gone through the journey and who are now able to guide the next generation.
And I think it also speaks to mentoring and coaching. Gloria, you run an organization that provides coaching services for women to help manage their careers and lives. Talk a little bit about the types of services that you do and what success looks like, which I'm pretty sure is very different woman to woman.
Success is very different for each individual. And one of the things that we do in our program is we ask each woman who goes through it to develop her own strategic leadership action plan. Because we start from the perspective that you are the CEO of your own life. No matter where you are in an organization, whatever your position is within that organization, you're still the CEO of your life. And what happens with your life is ultimately your responsibility, where you go with it. So what I found in the research that I did for the last book that I wrote, which is called No Excuses, 9 Ways Women Can Change How We Think About Power, is that women and men are socialized differently around power and intentionality. And it's just as Nisha said, women are socialized more to say thank you for whatever we get, and not to realize that, wait a minute, we really are perfectly entitled to ask for, to first see what we want and see where we want ourselves to be, and then secondly, make a plan and ask for what we want and have a way to get there, have a road to get there. So what we do is we help women really have a better relationship with power, redefine power, understand it in a way that we feel authentic about it, comfortable with it, confident about it. And then I teach what I call the 9 leadership power tools that are skills, such as the kind of tips that you were giving just a moment ago. And then we have each woman make a plan, and we provide coaching services to go along with that to help her implement her plan.
I love that you're the CEO
of your
own life,
Yes.
right? A really, really simple thought. So we all go through, right? We would want to have a career. Yes, we want to have a family. Yes, we want to contribute and give back to society. We want to find mission-oriented activities like newbeat.org and how we're doing this. What we sometimes say to women is, you can have it all, you just can't have it all at the same time.
Right.
Or we say, yeah, but don't you feel lucky for where you are? And I think in 2019, it's more than just luck. But I think men feel the same way. I think we are seeing today men who say, yes, paternity leave is important for me as well. There are lots of supporters, particularly in healthcare, and I think just reiterating your point, Nisha, there are a lot of men who recognize that having women as part of their leadership team or women leading components of their organization it makes the organization better. So I think that when we look at how does a newbeat.org continue to contribute to this, I think we want to see those men sharing those stories.
Right.
We want to talk about how do individuals do this, right? What's the story we tell of, yep, no, when I was having kids, I made sure that I did more work in the office. By the way, I made sure I was with a supportive employer. And I think hearing those stories across the country of how physicians are managing these lives really gives people ideas that, yes, you too can do it. Because one of the things I think about a lot is for the kid who's in high school today, a newbeat.org should be something that they go, I know what to do. It's a great roadmap for where I want to go in my life. And I just looked at 3 women who look totally different from each other, and they're collaborating, and they're also saying, we did it and you can too.
Right.
So Nisha, you're today balancing family, work, co-founding a newbeat.org. Thank you for all of the efforts. And so these are all important components of your life. How are you and the other young female cardiologists looking at what does balance look like? How do I continue to grow in my career? And how do I become, right, the woman, mother, leader, everything that I'd like to be?
Absolutely. I think I've heard exactly what you said about you can have it all, you can't have it all right now. And I would challenge that to say you can have it all right now. You don't have to be apologetic. I think everybody can find their own balance, and every woman's journey is so unique and individualized to them. Just like Gloria said, you are the CEO of your own life. So you just don't, you prioritize things in the manner in which they occur in your life. Part of, I think, what has made my short career successful is that I go with it. So, you know, we don't apologize for taking maternity leave, and, you know, I prioritize my family above anything else, and I make sure that I surround myself with employers and with other faculty that prioritize their families as much as I do, and whether they're men or women, it's important to talk about these things. I think so often women feel guilty discussing their home life at the office or in, you know, at a work event or scenario, but it's so important to make sure that people know that you're a human, and men do that too, and yet there's no guilt that that they have associated with it. And so I think a part of what I would say to any woman who's coming up in whether it's healthcare or any other field is that you need to just empower yourself and never apologize. You can do everything that you want to do. It's difficult, and you will not sleep as much as everybody else, but it's possible, and it gets better and better. I think when you have a fully enriched life, there's no downside. There are days where you're an awesome mom and you're a terrible doctor, or there's days that you are a rock star doctor and you're like, oh, I really, you know, undercut my kid today. But I think that it's important to go through that struggle and to talk about it because it's real for everyone.
May I add something to that?
Definitely.
There is in the workforce something that's called a mommy penalty and a daddy benefit. The things that Nisha was talking about, being with your kids, getting, you know, taking time to go do something with your kids and balance all of that. When men do that, they are considered just fabulous. They actually get paid more, they get respected more. On the other hand, it's assumed that women, when they have children, will pay less attention to their careers, which is so not true. And so that whole thing needs to be erased from our workforce. And the thing is, we're living in a workplace culture that was designed by men for men who had women at home taking care of the house and the kids. Most families don't live that way anymore. Right. Very few families have that structure anymore. And frankly, the younger men that I see, they want more balance in their lives too. So we're actually helping them by helping to change the system.
Absolutely.
I agree. Yep. And I think a newbeat.org has to tell those stories as well.
Right.
Right. And so I think change is not how do we empower and there's somebody else that goes down. It's how do we make all boats rise equally. And I have to say, throughout my career, almost all of my early mentors were men, incredibly supportive, and they all would say one thing. At the end of the day, the one thing we regret the most is that we did not spend as much time with our families.
Right.
And they owned it. And they would say, so don't feel guilty about how you manage your career to do that. Our event at newbeat.org and our first meeting that we had was very well attended.
Absolutely.
We got a lot of great engagement as part of the program, and really emphasized how focused people are in 2019 on gender disparities and healthcare disparities. And it wasn't just, what are women's healthcare events looking like now, but we heard almost every specialist speak. I noticed African Americans have worse outcomes.
Right.
I see that access to care is a really big issue. We need to understand what are the cultural needs necessary when we interface with a patient. Yes, they may trust a woman more than they trust a man, and an African American or a Latino patient will trust someone of their same culture more. How do we make sure we're improving, right, the pipeline for all physicians so that that occurs? And then how do we make sure when we talk about access to care, we own what that means? And that does mean, can someone get to the office? If they can't, do we offer telehealth services in our practices? Do we understand how people are paying for their health care? And yes, that means that as healthcare providers, all of us need to understand health insurance better. That's actually something that should be a must. Interestingly, a number of women physicians, actually all young physicians as well, are going into their careers today and they're getting MDs, but they're also getting MPHs and MBAs. And at some point for a newbeat.org, that is an area we'll talk about a little bit more. How do new leaders own the fact that their responsibilities are not just clinical care in the 20 minutes that they see a patient, but it's really how are they improving care in a community and understanding the business aspects. I think one of the themes that we really discussed yesterday, which was really heartening, frankly, at all levels, was that all of the aspects, be it new drugs being done, clinical trials, and do they have enough men, women, and underrepresented minorities? Are we making sure that we understand the formularies of the drugs for our patients? Are we making sure that guidelines take this into account? And though we started some of these conversations yesterday saying, well, that's another stakeholders area, or, well, what's the pharmaceutical industry doing? What's the insurance industry doing? It was heartening to hear Dr. Keith Ferdinand, Dr. Marty Leon, Dr. Roxana Maran say, we own this. All of us own this. We are the ones who understand the issues, and to quote Hamilton, we need to be in the room when it happens and sitting at the table. And that is what a newbeat.org is attempting to do. This isn't it's somebody else's, it's ours. It's going to be ours. And we have a say in what happens. When you do these, Gloria, I've heard that women say, gosh, I'm leaving now, understanding how to go back to my organization and make sure that people see me as someone who wants to learn, but also wants to make sure that I'm representing a different point of view. That's tough for women. I think women are sometimes, it's kind of, well, are they pushy? Are they leading a bit too much? So you walk that fine line of how do you manage that? What do you tell women? How do you manage that?
Well, you've been using the word empower, and the first thing I do is to say I don't use the word empower because I know you already have the power. I'm just going to work with you and help you understand the power that you have.
I love that.
And the way you can make choices about that power and how you use it. And the tools and tips, and we actually do a program that we call gender bilingual communication. So that, and it's about how you communicate effectively across not just gender, but culture too. You have to communicate effectively across gender and culture. You mentioned that you go to Paris for New Year's every year with your husband, and you probably know a few words of French, right?
Oui, je parle français.
Yeah, okay, see? When you go to another country, you learn something of their language as a matter of respect, and so you can get what you need there. And it's the same thing with communication. And that's a power that we learn and that we teach. And I truly believe that the data is so clear that in addition to the fact that companies with more women make more money, there's also the fact that women are earning almost 2/3 of the college degrees now. So, you know, in all the professions in the healthcare world, women are prepared. And so there's all this opportunity, there's all this capability, and so what I focus on in Take the Leads programs is you have the power. Let me just help you know how to see it, assess it, and use it in a way that makes you happy, that serves you and your life. And one of the programs we've developed is called 50 Women Can Change the World. And the secret sauce in that is the 50 women. So it's not only teaching the content and the leadership skills, it's also building a cohort of women who, once they've been together for a few months and they get to know each other, they organically start helping each other. They form a network. They create their own rooms. They create the rooms where it happens.
That's great. And Nisha, I'm going to ask this about caring for women and the types of medical conditions we talk about where there's a higher risk in women. We talk, you know, pregnant women and PEs. Yeah. What do we do? African Americans, VTEs, right. Much higher risk. Cardiometabolic conditions, how we look at women, how we look at underrepresented minorities. As we go ahead and do care today, what are the areas you look at for guidelines, for research? How do we make sure that as a newbeat.org, we're contributing and being a part of when these clinical type decisions are being made?
Absolutely. I mean, I think one of the biggest things is that as a healthcare clinician, as anybody in the healthcare field, we are so trained to look at every patient with the same lens. And I think that what we need to now train the new generation and ourselves to do is that every person is different. Every woman is different. Every patient is, the risk profile is different based on somebody's gender, based on somebody's race and ethnicity. And we need to be more aggressive or more lenient with medications and with referrals. I think that the areas that are so important in women's healthcare in particular is, like you said, maternal mortality and the why it's so high in the US, and why aren't we looking at that? Why aren't we studying that more? What are they dying from? And I think that was such an important point that came out of yesterday's program. I think another area of focus is that there's a lot of research now looking at why are some women presenting with heart attacks without actually having coronary disease? What are these women having? Because clearly it's something, and it's important enough that their biomarkers are abnormal, things are different, they're admitted to the hospital, but yet we have no answer and no diagnosis when they leave. And would this be a bigger, this must be happening in men as well, but because it's more predominant in women, it's just not as studied. And that's something that's being researched now, and it's so important and so vital to continue that work. I think looking at any of the conditions that disproportionately affect women, just like we talked about yesterday. I think the fact that I learned that African American women have a higher rate of fibroids, and so they have a higher rate of VTE. That was something that was new to me, and so profoundly, it's so simple and something that you should be looking at and should be tailoring your treatment. And I think that was such a great point that was made by Dr. Rosenzweig yesterday. But these are the reasons why we need a newbeat.org and why we need these conferences, why we need these conversations, is because we have so much to learn from one another. And without these conversations, it's just we're not going to be able to get to the next level of care.
Thank you. I want to thank you, Dr. Nisha Jhalani.
And thank
Gloria
you.
Felt. I'm Cheryl Pegus. We are part of a newbeat.org. Our goal is to continue to not only provide information, but really provide activities that allow you to care better for women, but also to further your own careers. Thank you.